why your sciatica keeps coming back even after it seemingly gets better. So your sciatica improves, then maybe a few weeks later, it's back. The cycle is incredibly common. Today I'm going to explain why it keeps coming back and what most people miss. Remember, symptomatic relief doesn't necessarily mean resolution. Oftentimes, the symptoms start to disappear before the system's fully restored. So the symptoms go away and the system isn't completely fixed, meaning the underlying issues are still there. So today I'm going to teach you why your sciatica keeps coming back even after it seemingly gets better. Hi, I'm Dr. Matt Bradbury, Family Corrective Chiropractor here in Georgetown, Ontario, Canada. This is our practice, One Life Family Chiropractic. Today I'm going to be talking about why your sciatica keeps coming back even after it seemingly gets better and what to do about it starting today. Of course, if you're just joining us, remember, I love having you. I love being a part of your health journey. Take a moment if you enjoyed it and want to continue to be a part of the journey. Make sure you subscribe, make sure you like so we can keep interacting. So reason number one is hip mobility drops again. Sitting returns, you spend more time flexed over, those muscles in the front get more short and contracted, and you're sitting so much that you may even be more tense this way and in more of that fight or flight protection mode. So tension may be up, and the back and the nerve are taking more of the potential load. So what I want you to consider right away is make sure you're up moving around, and also this stretch right here, this is a great one, something simple that you can do, especially multiple times throughout the day. Make sure you just get up and move. And what I would do is hold this position for 60 to 90 seconds. You may do it multiple times a day, once in the morning, once before lunch, when you get back from lunch, in the afternoon again. But what you're doing is really trying to offset, that 35 to 40 hours a week of sitting flexed over. And of course, if you find yourself sitting, positions like this can be really useful in terms of opening that hip up. And you'll notice what I'm doing is using this arm to lightly draw the ankle towards the ceiling while I'm pressing down with this hand. And I'm going to keep my spine nice and straight. I'm going to lean over, and you may hold that for 20 to 30 seconds and then back off slightly, 20 to 30 seconds, and repeat that 2 to 3 times. Just focusing on, stretching your glutes, but also opening up your hip capsule so that you're not so stuck doing those things that recreate those problems potentially. So you're going to focus on your breathing here. Really two simple tips that you can do to help open up your hips right now. And reason number two, your glute timing just becomes off again in terms of your back starts to take more of the load and your glutes aren't necessarily firing at the right time. So remember, jump in, make sure you take some time, whether you're going to the gym or you're just spending some time working on yourself, whether you're at the desk or you're at home in the evening. Spend some time doing one of these. When you're back like this, lift your hips up, squeeze, and back down. I would work for at least 8 to 12 on each side, really focusing on, cueing your glutes so that you can help improve that timing again. And so your back isn't taking so much of the load, but rather your glutes are kicking in at the right time to help protect you and look after you. And reason number three, the load starts to creep back up again. Your recovery might be going down. You might be taking less time to recover. The load's gone up and you're starting to reach your limit again and you're not adapting as fast as you would like. So consider, changing the load again, resetting, taking a short deload so that guess what? You can help keep yourself in the game longer and help take that little reset so that things have the time to heal and you can adapt and help bring yourself back up stronger than ever. So the missing piece is often the maintenance. Remember, previously, you probably made some tweaks to help bring you back to health. Those new habits were key in terms of helping you sustain it. If you stop them or slow down with them, then guess what? Your old ways started to creep back in, which is going to potentially create, that problem again. And if you let the function deteriorate long enough, then the alarm bells may be going off in the form of symptoms. So guess what? You have to go those things you were doing that helped recreate the healthier version of you. So what to do instead? Well, first of all, I would make sure you're up, walking, moving around. Number two is, making sure that you're actually working on your glutes and the timing to help keep your glutes strong so that guess what? Your back doesn't take more of the load. And number three, keep working on that hip mobility so you can keep yourself mobile and that the load is distributed more evenly amongst the tissues. And what you're trying to do is keep your tissues as healthy as possible and keep yourself more resilient for work so that guess what? You're less likely to break down and get to the point where the alarm bells go off again and you start experiencing those sciatica-like symptoms. And oftentimes, you've been doing all these wonderful things, but guess what the X factor is? The health of your spine and nervous system. And many people are working on, well, they're doing their walking, they're doing their hip mobility, working on their glutes, and the one missing piece of the puzzle, or that factor in your health, is going to be the health of your spine and nervous system. And if your spine is shifted and stuck and the nerves are potentially irritated, that's going to be a factor in how you heal and perform. And remember, your brain communicates with your muscles, organs, and helps with how you heal. And if those nerves are irritated, then that's exactly what your corrective chiropractor looks for. And oftentimes, there's going to be areas we feel, i.e. if you're experiencing sciatica, but there's going to be many areas that we have no idea about. That's why it's so important to get tested to know what's going on the inside so your body can work and function at its best. So consider the health of your spine and nervous system as well, which can be vitally important. Hope you had fun hanging out today. I always enjoy communicating the message with you and helping you out. And of course, I mentioned in the past, we got a big mission in terms of helping people understand their health more. More function means more health, and their spinal health is vitally important in that equation. I can't do it alone. So take a moment. If you enjoyed it, please take a moment to share this message. And if you liked it, I love interacting with you and helping you along your journey. So please make sure you subscribe and like so that we can see more of each other. Anyways, we'll talk to you soon. Have a great day. Bye for now.